And welcome to Deuk Spine Institute, April 3rd, 2025. Our patient is here for bilateral piriformis muscle release. Look at the x-ray there, the arrow. Show us the arrow, Jordan. Do a circle. The arrow is pointing to the top of the hip, which is called the greater trochanter. There's a little protuberance of bone. And attached right there where he's pointing is a muscle that runs from there over to the butt crack area, and that's called the piriformis muscle. We're going to cut the scarred up fibers of that tendon because that's causing horrific pain for this patient. And we just did this side. Left, we're going to go to the other side. But Henry, why don't you show the audience how a tear in the piriformis muscle, which comes from bending over and twisting your hips, how that tear can be so painful for patients, and how we like to fix it here at Deuk Spine.
Of course.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. You can see from our video that the piriformis muscle, which runs deep in the top half of the buttock, is really, it can be torn so easily through just bending over wrong and overstretching the muscle. Once it's torn, it's virtually impossible to fix it itself. Your body tries to heal it, but it just doesn't heal. And you guys see where the tip of my probe is there. That's exactly where the muscle attaches. It runs up to the left of the screen towards the middle. And my job here is to release these muscle fibers because they're all scarred up, causing this muscle to be very painful for the patient. All right, we're just about done. Any questions from our audience?
At this moment, no current questions.
Excellent. Shot. Good. All right, I think that's it. What's amazing about this procedure is that it actually works to get rid of the piriformis pain, and we've not had anybody have the muscle pain come back. We've had a couple of patients that we got about half the fibers cut, the other half didn't get cut, because what you're doing is you're using kind of the anatomical area plus the feel of the probe. So sometimes you might miss a few fibers, and if that's the case, the patient might still have some pain, in which case we have to repeat the procedure and do it again. But that's not common. It's about 1 in 50 patients. You can see how small the incision is, just 4 millimeters. Luis, great job today. Any other questions?
At this moment, no current questions.
All right, team, great job. Thanks, Henry. You can end the stream on this piriformis syndrome.